morning and welcome to the chat on Newsday Amarillo and News Channel 10-2. I'm David Lovejoy.
Hello, everyone. I'm Rhonda Lahnert.
And I'm Chuckalicious, Chuck Williams.
One of the biggest problems in our community and our society right now is dealing with chronic pain. You'd be surprised at the number of people who deal with a constant nagging pain, whether it be your joints or your knees, your back, whatever. There's just a ton of people out there suffering. Today, we're going to sit down with Dr. Victor Taylor. He is with Advanced Pain Care. We're going to address the issue of chronic pain. Doctor, thank you for taking time out for us today.
Yes, sir. Thank you for having me.
Well, Doctor, it seems like that chronic pain it's almost seems like an epidemic. It affects almost. There's probably nobody in this room or on this screen that's not affected by it. Either they have pain or someone they know or love has pain. Tell us about what is chronic pain. Just give us the general definition. Let's go from there.
Well, you're exactly right. Tens of millions of people in this country and around the world suffer from chronic pain. Basically, chronic pain is pain that lasts technically longer than 12 weeks, but it's pain that lasts beyond the normal healing time frame for an injury. So people normally, you think, well, you stub your toe, it hurts bad. Within a week or 10 days, it's pretty much healed up. But for some people, that pain persists and just goes on and can last years.
Well, I've reached the age where chronic pain is my thing, When you start talking about stuff like hip pain, how much of that is congenital and how much of that could be just chronic pain?
That's a great question. And I think obviously a lot of the pain we have is related to how we've used our bodies over the years. But there's a significant, I think, genetic component of that. We have people in their 90s who their spine on x-ray looks like a 25-year-old.
Right.
And we have people in their 50s who on x-ray their spine looks like they're 80. So I think that part of that's the genetic component. Because we'll see people who've used their bodies hard, people who are cowboys or did hard labor or other things, and they turn out okay. And then we have people who have a desk job who don't. So there is a big genetic component, but then probably at least half of it's from the way we've not only used our bodies in our lives, but how we've maintained them through exercise and diet and other things.
Doctor, what's the impact of chronic pain on the people who deal with it on a daily basis?
The impact is tremendous. For people with severe pain, it's basically like you're being tortured 24/7, except when you're asleep. For other people who pain is not quite as severe, it still has a huge impact. It makes you not want to do things. You don't, if your back's hurting and it's nagging at you, maybe you don't want to go play golf, or maybe you don't want to go bowling, or maybe you don't want to go sit through your grandkids' basketball game because the bench hurts. And so you begin to withdraw from activities. And that can lead to isolation from your family, breakdown of your self-image, where you don't even see yourself the way that you had in the past. So the impact of chronic pain can be a very severe impact on a person's life.
What is the best way to deal with chronic pain?
For a long time, the way we treated pain was with just a pill or something like that. And it turns out that the best way is actually to take a multi-pronged approach to the treatment of pain. Medication does play a role. And there are multiple different medications that can help with pain, not just opioids, anti-inflammatories, certain types of drugs that are good for nerve pain. All those can play a role. What we do at Advanced Pain Care is mainly interventional techniques. Of course, we use medications too, but interventional techniques are things like epidural steroid injections, nerve ablations, which can really help with like back pain, neck pain, that kind of thing. And then neuromodulation is kind of the front cutting edge of dealing with severe chronic pain. And what neuromodulation is, it's kind of like when your heart's not working right, you may get a pacemaker. Well, when your nervous system isn't working right, we can put in an electronic device that can modulate the nervous system. Mm. And then the final component of dealing with chronic pain, and one of the most important, is rehabilitative exercise, rebuilding the strength of the body so that you can maintain kind of your biomechanical integrity, so things work better.
You don't have to live day to day with chronic pain. Give the great folks at Advanced Pain Care a call. They're located right here in Amarillo, Texas at 7901 Southwest 34th Avenue. You can get your life back. You can battle this problem. Dr. Taylor will be happy to sit down and speak with you about it. Give him a call at 806-350-7918, 7901 Southwest 34th Avenue. Start living your life pain-free. Doctor, thank you for your time this morning.
Yes, sir. Thank you for having me.
Anytime. We'll take a break. We're back with more chat right after this.